The federal government's announcement today that it will inject more money into after-hours doctor services has prompted a mixed reaction from health experts. Now, under the latest proposal, 63 general practitioner clinics across the country will be given grants of up to $100,000 to offer extended services, including direct home visits from doctors. It's part of a $263 million push by government to try and reduce the number of people who end up in emergency departments. It also includes the recent launch of a national GP hotline. Health experts say while the hotline has been a great comfort for many people, it doesn't change the fact that in 85% of cases, patients really do need hospital care. Deborah Cornwall reports.
They're usually terrifying situations, especially if your child can't breathe. That's a scary thing to go through.
This is kind of Kris Kringle type gifts. It's not going to create a reformation, but would you rather have it than not have it? Sure.
It's been decades since the old school family GP could be dragged from his bed for house calls.
The doctor is technically qualified to make them feel better. The patient expects that the doctor will do his best.
In fact, for most Australians, an out-of-hours medical crisis almost always ends with a marathon wait in hospital casualty. For 3-year-old Elsie Faulkner and her parents, there's no question that a panic trip to the nearest hospital is the only option when she goes into anaphylactic shock, the result of acute food allergies and severe asthma.
If she's not attached to an oxygen pump, there can be varying degrees, but the situations we've had, if she doesn't have oxygen, her oxygen starts going downwards very, very sharply.
But for many people, especially parents of young children, simply getting access to a local doctor may well be enough. And after repeated promises of a root and branch hospital reform, the Gillard government is now attempting to take some of the pressure off hospitals with a modest yet popular move to expand after-hours medical care.
All up, the government is spending $260 million making it easier for people to see a GP when they need to, where they need to. If people can get a couple of stitches or get a little bit of advice about the temperature they're running from a GP, it's much better to do that than to turn up to an emergency department.
Today's announcement of grants up to $100,000 for 63 GP clinics across the country is the latest federal initiative to help boost after-hours healthcare. For some communities, that will mean more home visits by doctors. In others, extended opening hours at the local GP practice. It will also complement the after-hours GP helpline, launched 4 months ago, which is designed to help assess patients and, where possible, divert them away from hospitals.
Well, the GP hotline has received 70,000 calls already in its first few months of operation, and about a third of those calls are from the parents of children under the age of 5. It can be a very nerve-wracking time if you've got a child who wakes up in the night with a temperature or a rash, and sometimes what parents need is a little bit of reassurance from the doctor on the other end of the phone. Sometimes what they need is to get their child to a hospital or to a medical specialist as quickly as they can.
When you scratch below the surface, this government ripped out $60 million from after-hours care programs last year, and yet they want us to applaud an investment of $6 million today. Well, I think it's smoke and mirrors.
Sydney jewellery designer Natalia Heath had no idea she even needed urgent medical care recently when her hands started to stiffen and swell after she was bitten by a cat.
Because I didn't want to go to emergency, basically. I didn't want to particularly go there, but I also didn't want to clog up the system.
It was only after ringing the GP helpline on the advice of a late-night chemist that she found herself being admitted for emergency surgery.
I probably would have spent more time in hospital had I waited, because the infection would have spread and I would have been a lot sicker in the morning.
Public health experts say while the government's first baby steps towards providing alternatives to hospital were commendable, The lion's share of hospital admissions are still patients with chronic conditions, patients who could have avoided hospital entirely if they'd had access to the right treatment.
We should not see it as the kind of magic wand. People sort of breezing up and being regarded as an inappropriate arrival at the emergency department, not the vast majority, they may be 10, 15%, but the vast majority of people there have a real need.
The Australian Medical Association has also questioned whether the helpline will reduce pressure on services or just add another layer to the system.
There's no doubt calling someone makes people feel better. The real question we've got to ask is, does that actually change presentations at emergency departments? Or even does it change presentations to people going to their family doctor? There is one thing that's probably useful here, and that is that talking to somebody in person who's a medical person is a lot better than going on the internet and doing your own research.
But no matter how carefully crafted the government's efforts to steer patients away from hospital, say the experts, it's still just as terrifying when you wake in the night struggling to breathe or panicked by chest pains.
It's a lonely business trying to deal with that on your own. I think that we've got to be very careful with this rhetoric about, don't go to hospital if you've got a health problem because, it's not for you. Well, sorry, it is for you. That's what public hospitals are for.
Deborah Cornwell with that report.